Welcome parents, I'm Jenni June, Certified Child and Family Sleep Consultant and Lactation Counselor. I have a special segment here for you today. It's a little different than what I usually do, and it's because it's outside of my scope of practice. I want to talk about something called myofunctional therapy. What's myofunctional therapy? Well, I brought some friends with me that are going to describe what that is, break it down for you, and tell you what to look for and why it's so important. Dr. Martin Gorman and Sonda Pinkerton are here with me, and Sonda is going to tell you what that means.
Thank you, Jenni. Myofunctional therapy, it is a series of exercises we teach children with poor oral habits to promote optimal facial growth and development, and most importantly, how to breathe.
Sonda, tell me what some of the symptoms are that you would look for in a child that you believe might need myofunctional therapy.
Well, the most common ones are mouth breathing, tongue-tied, tongue thrusting, crowded teeth, grinding during the sleep, dark circle under the eyes when they get up in the morning, allergies, hyperactivity, also short attention span.
We have realized that in the course of our practice that a tremendous number of adult patients that we treat for different disorders have a lot of the symptoms that Sonda described, and they have improper oral facial development, and they don't sleep well, they have TMD issues, etc. And we come to realize that it's a improper biologic development of these adults, and it all started when they were little kids at 2, 3, 4, 5 years old. And if these issues are addressed at that young age, we can alter their development by teaching them proper myofunctional habits, what they should be doing and how they should be doing it during the day, and when they do it all day, it just carries over to the evening when they're sleeping. So they grow and develop properly.
Wow, wonderful.
That's it.
Most of us don't know that stuff. Until just a couple years ago, I didn't know that stuff. And I think that's important for learning about proper facial growth and development at a young age, because we can really change the way their face grows and the way they sleep, the way they breathe.
And even the ears, kids get a ton of ear infections,
Right.
and it's a function of the tongue not working correctly, and instead of nasal breathing, your mouth breathing, and the eustachian tubes don't get the airflow they should have, so they don't grow and develop correctly. And it's small things like that that are affected that people don't know about.
And that might even start with being tongue-tied as a little baby.
Absolutely.
As well. And
Yes.
With nursing,
right.
if you're tongue-tied, the baby can't nurse correctly.
Ah,
and
right,
breastfeed.
that's true, yes.
You can't breastfeed, so it all starts there. One of the issues that I think should be mentioned is that if you wait too long, what happens is the muscles are pulling on the bones incorrectly with the different swallowing and breathing the child's doing so they can survive, that the bones are permanently altered.
Wow.
And then it's obviously much more difficult to change the shape of bones once they've developed. So it's really critical to start treating children at 3, 4, 5 years old.
That makes perfect sense. Wow. Well, thank you both for being here
you.
and for
Thank you.
educating my audience about myofunctional therapy and how important it is to catch this stuff early. Thank you for being with me, guys. I want you to post your comments and your questions below, and Dr. Gorman will do his best to answer some of those for you, and Sonda as well. We'd love to hear from you. Thank you so much. Have a great rest of your day.